How can we avoid CF misdiagnosis? Imagine trying to solve a puzzle where some pieces look alike but fit differently. That's what diagnosing cystic fibrosis involves. It's a complex process that needs careful steps to get right. To avoid misdiagnosis, healthcare providers relying on a combination of clinical evaluation, biochemical tests, and genetic analysis, all guided by established guidelines. First, recognizing the signs is important but not enough. Symptoms like persistent cough, lung infections, difficulty gaining weight, or greasy stools can suggest cystic fibrosis, but they also appear in other conditions. So, the key is confirming whether the underlying problem is the dysfunction of the CFTR protein, which causes the disease. The main test used is the sweat chloride test. It measures the salt level in a person's sweat. If the salt concentration is high, it indicates CFTR protein malfunction. This test must be performed in specialized, accredited laboratories to ensure accuracy. A sweat chloride level above a certain threshold confirms cystic fibrosis. If results are borderline or intermediate, further testing is needed. Newborn screening programs also play a vital role. They measure levels of immunoreactive trypsinogen in blood samples taken shortly after birth. Elevated levels suggest CF but are not definitive. False positives can happen, especially in premature babies or stressful births. That's why positive screening results should always be followed by confirmatory sweat testing and genetic analysis. Genetic testing looks for mutations in the CFTR gene. Since there are over 2,000 known mutations, some have clear links to CF, while others are less certain. Interpreting these results requires expertise. Sometimes, genetic findings are inconclusive or show variants of uncertain significance. In these cases, combining genetic data with sweat test results and clinical signs helps prevent misclassification. Following established diagnostic guidelines from reputable organizations like the Cystic Fibrosis Foundation helps standardize the process. Using a multidisciplinary team including pulmonologists, geneticists, and CF specialists ensures that all aspects of the diagnosis are considered. For cases with unclear results, ongoing monitoring is recommended instead of rushing into a final diagnosis. Testing should be done in accredited centers with experienced staff to minimize errors. Healthcare providers should also be aware that CF can present differently across ages. Older children and adults might have milder or atypical symptoms, so maintaining a high index of suspicion is important. In summary, avoiding misdiagnosis involves a careful, step-by-step approach. Using accurate sweat chloride testing, thorough genetic analysis, and following consensus guidelines. Combining these with expert interpretation and clinical judgment ensures that individuals receive the correct diagnosis early. This allows for timely treatment, which can significantly improve health outcomes. Always remember, if you or someone you know shows symptoms or has concerns, consulting a healthcare professional is the best step to get personalized and accurate medical advice.